Okay, this will hopefully supplement our discussion out at ARCO the other day, but I wanted to show you a few things here. This is going to be anything but conclusive, but there's another recording after this that shows a lot of the billing aspects of this. There were several questions there, and I want to show you what the X12 file is actually going to be capable of producing, things of that nature. This is actually an older version, and over here on the side it drills into bottom and top. See, it splits the screen based on left and right, bottom and top, and that's actually a little easier in this the new version. So what I will start with here is we'll just click right here. This is the schedule. This is resource-based scheduling, so if we had all users or if we right here there are basically only 2 users in this demo, and so you'll notice that it splits the screen for the calendar. If we wanted to view the whole screen as a calendar, we could do this. This is all over the internet, Internet Explorer that is, and so every computer in your facility will have access to all of this stuff, the reports, the office notes, calendar, patients, the whole thing. Billing even, we can obviously restrict based on username and passwords, but we're going to go ahead and pretend that we're only interested in actually that last one, and we're just going to click on the patient. And once we click on the patient, we have all kinds of things. So again, a lot of this is demo related, but the physician is going to be interested. Maybe they can go into the medical problems and see some of these medical issues. They can click on this. They can see the issues sections along with the encounter sections. They click on one and it'll show the highlights if that's related to the other encounter issues. So this issue, which is diabetes, has issues with allergy intake to milk, and we'll give sample medication, see back in office in 2 weeks. This one has no issue to allergy to milk, and you'll see how these drill down. Aspirin, issue with milk. Again, you can see how that communicates with each other. Now, if there's a scheduled event, which there are actually 2 on the 10/26 9 a.m., which was today, there was an office visit for first last, which we could say is Dr. Jones right here. And if it's determined that this patient cannot be here this time, this indicates for this particular physician all of the available times. And so if they would just choose one of the available times, it changes the time, and then you can go ahead and save that, and it'll move that here to 5:15 p.m. instead of 9 a.m. Same thing with Wednesday. They determine that they need to change it to another day at 3:30 p.m. They're going to save that, and you'll notice that it'll change it over here to the next day at 3:30 p.m. All the demographics are here. All these are very editable. They can all be edited just by going this way. We can undo the bottom. You can see how this is all very simple. A lot of information for insurance. You can have primary, secondary, and tertiary insurances. We can add insurances, all kinds of stuff. So again, just for brevity, we will not dwell on a lot of these details. Now I want to actually just activate the summary account here on the bottom again. And again, we've got medications right here, and when we click here again, it'll go to the medications and the issues and the encounter sections like discussed before. Now if we decide we actually want to change the medications area, we would come to the RX over here. Let's actually make this the whole screen. Well, we'll keep, I guess, the patient here. But we will go here. We can list or add prescriptions. We can print. Let's say that we are interested in printing these prescriptions here. Then we can this is what it should have done. There it is. And here's the bear. We can actually decide what prescriptions the patient needs, print it off, the physician can sign it. This is all demo. This would obviously all autofill. If we need to add a prescription, we can certainly do that, starting the list of providers, the drug lookup. We could certainly do anything that's R, grabbing a couple of examples here. We're going to say 2 milligrams, take 3, tablet form per apply to this. Well, let's see. BID. We'll give them 2 refills. Testing notes. Save. We can email this. We can fax it to a number, or we can simply print it. And when we print it, we can open it as before, and now it's got all the details. And not only did it print it and do all the details, but of course now it's in the list of prescriptions, which is Sectrel right here. You can print it later. Right here is a section for immunizations. You can keep track of a patient's immunization records. You can print those shot records right here, just like the prescriptions. Things can be printed. We would autofill certain database entries. It's nice if in reception they put all this stuff in. You can see how that follows through every single aspect of the system. With regards to documents right here, if we decide that we would like a document, then you click on it and you upload a file. It'll give you a browser, at which point you would browse your computer. We would set this up so that the first thing it brought up was just the list of files that you may want to upload. This would be good for scanning, probably scanning patient information, maybe patient ID cards, things of that nature. So if we decided to browse, and here would be an example if this was the image of the patient, or maybe their veins if you're in a vein center, but this would then follow through, and I'll show you where we can see that later. I'm going to remove the bottom here, and now I'm under the patient report. Here, if you just want to generate a report on the patient's insurance and billing and maybe transactions, you click generate report and it will generate the report. Now this again is not much data for a demo version, but you can appreciate the ability here. I just added a couple of things such as history data and patient data, insurance data, all that. It all shows up. Immunization records, and there's the patient's immunization. There's diphtheria. Back. Same thing here for the patient report. Issues, any of the issues that have been added are then including medications and a brief consultation. You generate the report. We still told it to do the patient data. We've got the medications, the patient encounters, review of the system's checks, which I'll show what this is in just a moment. One thing I'd like to do is actually activate the summary again here and show you on the summary. Earlier we added a prescription. Anytime this patient is scheduled, they're going to add they're going to notice all of the prescriptions that are being taken here. There are chart notes. They have access to all the chart notes, obviously. Chart notes over here, if we go to patient notes actually, is this. And here they're able to add chart notes if there's an insurance note, testing, insurance. And then we add the new note. Or if there are billing issues, payment plan of $20 monthly. They can add that note. You can see that these add with the time and the date stamp. Here's where we would add issues, right here. If they want to add an issue, we would indicate maybe that it's an allergy to penicillin. And I don't know, let's say it just recently started, it's still a problem. This is the first occurrence. We save this, and then when we go to new encounter,